All right, then. When an institution, education or otherwise, is in focus, we concentrate on its strategic goals or social impact. Today, we shift our focus on St. Luke's Anglican Hospital in Wusasa, Zaria local government area of Kaduna State. As a secondary health facility, the hospital is licensed to offer a comprehensive array of services, which include medical, surgical, pediatrics, special clinical, and ambulance services. The hospital also holds a century-long history that's deeply woven into the story of northern Nigeria's healthcare system. Now, for a lot of people, it carries a more personal meaning, including our own Babajide Kolade Otitoju, who, on a visit to Kaduna State, returned to the hospital where he was born decades ago. Interesting. He described the visit as a moving experience, saying that the hospital has survived almost 100 years. But that visit also revealed the need for support. And let's take you there, Watch this.
Wusasa General Hospital, now known as St. Luke's Anglican Hospital in Wusasa, Zaria, holds a century-long history that is deeply woven into the story of northern Nigeria's early healthcare system. The hospital began in 1929 as part of a Christian missionary settlement that also established a church and a school in the then emerging community of Wusasa. It was one of the first organized medical facilities in the entire region, created to serve local families at a time when access to healthcare was extremely limited. Over the decades, the small clay-walled structure built by missionaries grew into a recognized secondary healthcare center. Its original buildings, or what remains of them, still forms part of the hospital's heritage, a reminder of the long journey of modern medicine in northern Nigeria. A plaque at the hospital bears the inscription of one of North's most respected medical pioneers, Dr. Russell Aliu Barau-Dikko, who laid the foundation stone there on May 18, 1966. Dr. Barau-Dikko, the first qualified medical doctor from the northern region, was himself a son of Wusasa after training at the University of Birmingham. Through the years, St. Luke's Anglican Hospital became more than a treatment center. It provided nursing training, welcomed patients across faiths, and stood as one of the most reliable health institutions in Zaria, second only to the major referral hospitals. For a lot of people, it carries a more personal meaning, and that includes veteran journalist Babajide Otitoju, who was on an investigative visit to Kaduna and returned to the hospital where he was born decades ago. His parents were living in Zaria at the time, and St. Luke was where his pregnant mother was brought as she went into labor. He visited the maternity ward, standing in the very place where she most likely waited, prayed and endured pains of labor, and eventually welcomed him into the world.
It was in the second stage that my mom, she brought me to bed. Yes, sir. As the English people, I was born in this hospital. And I told my brothers before I died, before he calls me, yes, this hospital where I was, I want to see it. Wow. So every time it comes to my mind. So I had not come to Kaduna since 2018. Okay. So this time I go to this on the invitation of the governor, he came to Commissioner for the states. Afternoon. So I said, okay, I will be doing a business. Let me see where I was born. So now, initially we thought it was a different hospital. Okay. Because the name has apparently changed from Yes, it used to be Wusasa Hospital. Yeah. So the name was now changed to St. Luke's Anglican Hospital. That happened, I think, in the early 80s. So when the name came down? Yes. So I'm happy to be here to identify the hospital where I was born. We learned from malaria. Received those one of those delivery. Yes, those deliveries. Let's go inside.
He described the visit as a moving experience, saying that the hospital has survived for almost 100 years, still offering care, still serving communities, and still holding on to clay structures that sheltered so many families before modern expansion began. But the visit also revealed something else: the undeniable need for support. Despite its rich history and unwavering service, several sections of the hospital are in urgent need of an upgrade. From the laboratories to the wards, and from the maternity unit to staff welfare, the needs are visible and pressing. The longevity of the hospital service stands in sharp contrast to its aging infrastructure. St. Luke's Anglican Hospital remains a symbol of compassion, resilience, and early missionary impact on healthcare in northern Nigeria. And if it is to continue carrying the legacy into another century, it will require renewed attention, investment, and collective support. Only then can one of the region's oldest and most historic medical institutions keep saving lives, just as it has done since 1929. Lupe Asom, TVC News, Kaduna.
Many thanks, Lupe. Biko, you know, when I watch a short documentary like this, the book, There Was a Country, comes to mind. There really was a country where things worked.
Yes, and we have to admit that even as much as we long to see change rapidly in our country, there are many things that have also improved. So it's not been a negative story all along. Yeah. You know? My children ask me, how did you cope when there was no GSM? And my wife answered my second son quickly. Said, we coped. People cannot do without it. You know, at least we coped.
My people will say, the thing you know see, you know miss them.
Yes, of course we didn't. But we are happy that at least in our lifetime, those things are here and they've made our life a lot easier. You can drive around Abuja if you have a map without even having lived in the city. The map will take you to everywhere you want to go to.
I behaved a little like a bushman when, for the first time, I went to Abuja on duty, radio now, and the man who took us started using the Google, and I was wondering how the Google works.
Yes.
It took
the
us.
map works effectively.
It took us to the place.
Yes. You
are 5 minutes away from the place, and I know that.
And it's most of the time accurate. So, I was born in that hospital.
Okay.
And so many other great Nigerians were born there. Remember, Gawan himself was born in Wusasa there.
Okay.
And he got married to a Kaduna woman. You know, remember during the...
Wusasa is,
in Zaria. Wusasa is a community just outside Zaria town. You know, just a community just outside Zaria town. And the missionaries were active there at that time. They built that hospital. Later on, it reverted to government control. And later on, it reverted back to the missionary. So I felt a need to go there and even see what the place looked like, because I saw my birth certificate and I saw the address. I then went there and saw that, this hospital is so rich in history. And I saw things that I didn't like in terms of the aging infrastructure. I told myself that, look, I had to do something for this hospital. And I'm confident that even my friends will be happy to also assist. A lot of the things that were there at the time I was born remain. There's still some old stuff, even inside the ward, because I entered the ward where my mom was dilated. I entered the ward where I was born. So it's a sobering experience.
Yeah.
To know that, to see the place where I was born almost 60 years ago, and it needs help.
Okay.
And I spoke with the CMD and I assured him that we are going to do something to assist the hospital to freshen up infrastructure in that place. So I'm happy that I fulfilled one of my dreams to at least get to that place where I was born. You know, and I'm sure I will still find time to visit it one of these days. Whenever I'm in Kaduna.
Well, it is said that memory is unkind to an old man, but to our brother, our colleague, this is a different memory. Brings a little something, you know.
I think this is quite a very fascinating human interest story, you know. And there are a lot of things that are tied to this story. The first one, as I'm just watching it now, is that the true Christians of the early ages were actually interested in uplifting the conditions of, you know, the poor conditions of people. Yeah. It's not just about prayers. Because that school was established by a missionary, I think Dr. Miller, you know, in 1929. And also we realized that that was not the only hospital that was built by missionaries. The first general hospital in Nigeria, built in 1993, was built by missionaries people. The one that was built in, the first one in Abeokuta, you know, Sacred Heart, built in 1895, was built by the Catholic. The oldest one in Ogidi was built in around 1907 or so, in Anambra State.
All right.
Then there's one in Calabar, Psychiatric Hospital, built in 1902, all built by missionaries. So compare with the missionaries of today, you could see that those early Christians were genuinely concerned with the plight of mankind. The hospital we are talking about was able to address a lot of public health problems. You know, leprosy, I mean, where Babajide was born, you know, malaria, you know, and was able to save so many human lives in Wusasa. And I also think it also depicted the level of integration. He is from Kogi State, but born in Wusasa. And it's talking about Gowon, all the way from Law in Plateau State, and Gas, born in Wusasa. So you could see the level of integration of Nigerians, that we actually traveled, you know, we mingled as one people. You know, but unfortunately today, people are shrinking back to their primordial enclaves. You have children who want them to go to Borno because you are afraid of people in Borno don't want them to go and serve in. So the country we are shrinking. You know, this is talking about almost 90 years ago, 1929. You know, you could see the level of integration when that school was founded. People coming from all over the world.
You know, even when we were younger, we were in secondary school, students came from the far north on exchange. On exchange program. Today, people are much older. They've gone to university. They are to serve their nation. They don't want to serve outside their state. That's why I'm happy that the NYC came up with a law now, whereby you cannot serve in your state of origin. In fact, the computer will automatically, if you want to switch to your state of origin, the computer automatically switches you off. You will not be able to do it. They can post you close to your state of origin. Like if you are from Kogi now, they can put you in Abuja. But to start in your state of origin, the NYC completely discourages it now. And that is how we can build on national integration. All of these places we used to enjoy visiting. My parents lived in Mina. My parents lived in Ilora, in Oyo State. You know? Really? Yes, that's the hometown of Baba Folawiyo. They lived in Koton-Karfi. So different places, and you get to know Nigeria a lot more.
And you speak the language, so you have a better understanding of the psychology of the people. You know, even though you are not from there, unlike what we have today.
Because Pomi speaks near impeccable Yoruba. They go ask me, are you sure you be video?
Yes, no. When you start blowing this proverb now, what's wrong with this man?
Well, so the idea was very beautiful. We can go back there.
Yes,
we can.
I'm happy that before I breathed my last, I saw that hospital, you know, and I went there, and I'm going to do my best. The resources that God has given me to improve the hospital.
I think it's a national treasure. In fact, I believe, apart from you, government, everybody, is a tourist attraction. Health tourism. 1929. So we should all be interested in investing.
You know, what fascinated me especially was the brickwork. You know.
It's still there.
Still there.
You see, that is the first stage for the what is it called? The maternity. The first place they take you to.
All right.
Take your vitals. Dilated, and then you have you get delivered of your baby.
It reminds me of good old dispensaries.
Oh, it's a baby factory, just like the one in Lagos that is described as
the biggest baby factory in Nigeria.
In Nigeria, yeah. Massive.
Yes.
Yeah. All right.